One of the projects that I worked on that directly fits into the risk and resilience methods or contributes to the work on risk and resiliency here at APT is the CDC Men's Testing Initiative. CDC MTI is what we call it for short. So the project was meant to identify men who have sex with men and have them aware of their status, and then get them tested, and then link them to care if they're tested positive. So we used various strategies to find men and get them tested. Among those strategies that's most interesting and most related to risk and resilience is the social network strategy. In that strategy, we used HIV infected men or men who were high risk for HIV to recruit other men in their social networks. This particular strategy proved to be much more effective in identifying the highest of high-risk men and finding more positives relative to the number of folks being tested. So in other words, it had a much higher positivity rate than some of the other strategies that we used. Overall in the project, we tested about 70,000 men who have sex with men across the country. But social network strategy had a positivity rate as high as like 9 or 10%, versus the majority of men were tested through mobile testing or venue-based testing, and that positivity rate was 3%. I think the main difference is social network strategy really helped to identify men who were sort of a trusted individual in their network who could get to the men that we could not necessarily get to through the venue-based testing, through bars, for example, or parks or parties.